So, welcome back everyone. Bienvenue encore pour la suite de ce symposium. Avant de passer à une présentation de notre invité international, il me fait grand plaisir de présenter ma collègue, Madame Suzy Joron, qui est chef des cellules souches à Québec et qui travaille dans le milieu de la greffe des cellules souches depuis 2008 au Canada. Donc, elle a été à Princess Margaret, au Saskatchewan Cancer Agency à Stickett à Toronto. Donc, une femme d'expérience qui va nous présenter notre invité pour une superbe présentation. À toi, Suzy.
Merci, Mélanie. Comme M. Tremblay parlait tout à l'heure, Emma Québec, en fait, on est beaucoup plus qu'on est connu pour le sang, mais bon, depuis 20 ans, on supporte là, la greffe, l'approvisionnement de produits de cellules souches. Et on fait partie d'un réseau mondial qui nous aide vraiment à avoir à obtenir les meilleurs produits pour les patients atteints de leucémie, principalement. Et aujourd'hui, j'ai un de nos partenaires américains, donc la représentante qui est Madame Dr. Joy Arrow de BioTherapies BioTherapies. En fait, c'est un partenaire canadien, un partenaire américain avec qui on fait affaire depuis longtemps et qui ont utilisé la structure, l'infrastructure et les services existants pour la greffe de cellules souches pour vraiment venir supporter les nouvelles thérapies cellulaires. Thank you for being with us this morning, Joy. It's a pleasure to have you with us. And thank you for coming to share your experience developing new therapies. So we wanted to share with our audience so we've been providing multiple services to support stem cell transplantation for many years. Can you please explain how the infrastructure that was already put in place for many years in your experience and how you use that to adapt and support the new emerging therapies?
Yeah, thank you all for having me. I really appreciate it. Excited for the discussion. So to your question, so back in Be the Match BioTherapies was started back in 2016, and the leadership at the time had seen the success and growth in emerging cell and gene therapies, and recognized that we had infrastructure that we felt really could help move these therapies with the goal to get them to patients faster. And so when we look, just look at the basic workflow of cell and gene therapies and align that with transplant, you need to find a donor, collect that material in a really high quality way, and be able to transport that material, in this case, to a manufacturing facility and then maybe back to the patient. And then also looking at that data post infusion into that patient and being able to analyze that data to improve therapies going forward. And so since Be the Match had developed infrastructure to support those different areas, we really felt we could bring that to these new cell therapies to help them not have to reinvent the wheel as they're looking to get their therapies to patients and really leverage what had been built.
Thank you. And where did you see the gaps that you were able to fill in terms of the need in the new sectors? Can you talk a little bit about how you leverage your strengths to support that ecosystem?
Yeah, I think there's a couple really critical areas that we found valuable. I think one is just in the sheer donor population. When you think of transplant, it's really critical to have a very diverse donor pool because you have that matching piece. For these emerging cell therapies, even the ones that don't have very specific, maybe a 8-of-8 HLA match requirement or something, they still have very specific requirements for donors. And so being able to go to that really diverse donor pool to find the right donor to make sure that what you're manufacturing is going to be the most successful therapy possible. So I think that's one of the huge advantages to working with a registry. The other area that we found that our partners found very valuable was in the logistics area and being able to manage time and temperature sensitive shipments. So if you think of like the typical pharmaceutical industry, they're dealing with like a lyophilized chemical that, you know, is good forever and ever. And when you're dealing with cells, obviously that's not the case. And so the, you know, the expertise that we've developed in terms of who do we want to work with certain shipping lanes, what do you have to deal with even with customs, those types of things, and being able to bring that expertise to some of these groups. And then just collection in general. I think a lot of these companies, you know, their background either is in very basic research where you're used to just like, you call up the local company and a leukopak shows up on your door the next day, or they're from traditional pharmaceutical and, you know, understanding apheresis and what a donor has to go through and all of the different pieces that you need to have in place to make sure that that material is going to be eligible and safe to use in a patient was new to a lot of folks in the emerging cell and gene therapy industry that we were able to help with.
Thank you. So we talked a bit about the logistics and how to really support and making sure that we have products that are safely transported and administered. Can you talk about what are the specific types of partners and companies you work with that most benefit from those services? Because when we were preparing for this this day, we talked about, you know, bigger pharma companies that do have the resources and infrastructure. So what kind of companies and other partners possibly in research benefit from those services?
Yeah, so we've worked with a really broad range of partners. We've worked with academic groups in terms of, you know, finding donors and getting, helping them with their therapies and getting to like move to the next clinical phases, as well as a lot of then that like small to medium sized pharmaceutical or biopharma developer that doesn't have a lot of that existing infrastructure. But we've even worked with a few of the really large pharma because they didn't have experience in cell therapy. So some of those different areas that we were able to provide expertise that you know, it didn't seamlessly go from like a traditional small molecule drug into cell therapy. They weren't necessarily able to leverage that exactly. You know, there were some areas with those big companies from like a logistics standpoint, some of that is a little bit, they were less interested in. So those small to medium definitely are helped more by that infrastructure.
Thank you.
Yeah.
And in terms of, we talked about what are some of the unique challenges that these smaller partners have and where you most benefit to try to get those therapies to patients more easily? What are the biggest challenges that they face?
I think there's regulatory challenges, you know, understanding the regulatory space. And a lot of these groups are really interested in not just, you know, for us, you know, whether it's the US and Canada that they're interested, but they're also interested broader, you know, global distribution, EU, Japan, you know, other areas in Asia. And so being able to understand some of that regulatory landscape and bring some of that expertise to them, that logistics, moving material. We've worked with autologous groups as well, that especially in understanding apheresis. So qualifying an apheresis center, training them to a particular protocol, auditing for that particular protocol, all of that was expertise that we have in-house that we're leveraging all the time for transplant. And so being able to do that so they can just get to the point where they can start treating patients faster and have that go through without having to build up that expertise.
Wonderful. And just because we were almost out of time, but last question. So as the field is evolving quite rapidly and there are many different therapies out there. So with transplant, it was pretty standard. You know, we had one type or a couple type of products. But now you're dealing with a lot more variety. So how do you adapt and how do you see in the future, how do you keep, you know, with the trends and and make sure your services remain relevant and optimized to serve the community.
Yeah, it's a great question and a great, I think, challenge for all of us. So we try to stay really present within the community. So attending conferences, trying to understand where the industry is at, following the literature, to see where some of these areas are trending, surveying the industry, and then really working with a lot of our partners like cell therapy labs to make sure that we have within our network the types of capabilities that we're seeing growing. So PBMC isolation, using isolated material, is one trend that we're seeing, that a lot of people want that as their starting material. So working with, trying to get something more standardized to support that is an example, to just keep on top of it. And I think the other thing that actually is much more near and dear to my heart that I'm a big fan of is really understanding what is an ideal donor for these therapies. So I think we've done a lot of work on transplant for that, to understand different age and weights and different requirements that we don't really understand for these therapies. And how can we, use some of the tools that we have used for transplant to help us find the right donors more easily to make the best therapy possible.
And I would add protecting donors' interests and all the ethical aspect of it is a really strong topic. So thank you. I think we'll move to questions. I think there is one question, or do we have time, Melanie?
There's not a lot of questions yet in the chat, but maybe I have one. We have only a few minutes. So Joyce, I'm sorry, you gave a lot of examples, but what, in your experience, what would be the top two services that offered the most, that had the most impact on the ecosystem in your experience?
So really, I think providing that starting material, that's where we've really put a lot of our more recent focus, and having that high quality starting material. That's kind of our number one. I would say maybe the second one is really in some of our consulting and bioinformatics work that we've more recently launched, to understand the HLA landscape, understand, okay, if I want to satisfy this % of the population, what does that look like from my cell banking strategy? And a lot of that data that we have as a transplant community, understanding HLA, is super beneficial, because there really isn't like another great spot for those groups to go.
Excellent. Thank you so much. Thank you, Suzy. Thank you, Joy, for coming, for sharing your experience. I think it gives a lot of very important information for the next panel. So now